Kisumu has experienced rapid growth in the last few years as the regional, administrative, commercial and industrial center for the Lake Victoria Basin. Kisumu's rich endowments, such as the lake itself and the fertile agricultural land, has given rise to a thriving economy. As Africa strives to be a leading player in global politics and economy, the county government of Kisumu, through the stewardship of Governor Peter Nyong'o, has made great strides as it endeavors to grow into an economic giant in the region. This is the story of Kisumu's transformation. This last year was marked by a strong focus on health matters in Kisumu County. This focus was heightened as Kenya and the world shifted gears to deal with COVID-19. Kisumu has been leading the pack with key strategic decisions on management and prevention of the spread of the virus.
When COVID came, there was a realization that the work was too much and the medics, the real so-called medics, could not handle it. And they had to devolve this into the community health structures. Now we took advantage of that because then people feared coming to facilities, and we operationalized the use of community health volunteers to be able to treat small illnesses at home. They're able to take use a thermometer, use a pulse oximeter, and be able to say that you are stable or you need to be referred to the next facility.
Like Joe TRH, the infrastructure got very much improved. And earlier on in the day, we managed to set up an oxygen manufacturing plant, which had never been there, with a huge capacity to produce oxygen for piping to the wards that were dedicated for COVID.
However, the pandemic also led to events unprecedented blessings in the public health in Kisumu County. Being a county of first, Kisumu County now has real-time data on COVID. The data that flows from different health facilities is instrumental in shaping decisions on COVID management and helps in proactive handling of the mutant virus.
At the ward level, we can see which ward has more positive cases, which ward is testing more, and this one helps anyone seated anywhere with access to the platform to zoom in and understand where these cases are and what needs to be done.
Community health is now digitized. The data is also centralized and can be easily followed. Monitoring of data has also contributed to a flow in patients' history.
Since we started using the digital platform, it has been easy to follow up the CHVs. It has reduced the cooked data. It has reduced loss to follow up clients since they are in the phone. You are able to get them anytime you want. And I'm also able to call CHV even from home since I have everything is on phone.
Thank you for calling Kisumu Emergency Operations Center. Mary speaking. How can I help you?
The Emergency Operations Center, EOC, was set up to offer 24-hour support to the residents of Kisumu on health matters. It has a toll-free number that helps in times of emergency. Kisumu residents have not only been shielded from catastrophic spending, now they can access affordable and quality health care thanks to the setting up of Marwa, a social health insurance cover for the people of Kisumu. Marwa is now targeting organized groups such as Mama Mboga, rice farmers, cotton farmers, among others, and also self-paying members. Since its inception to date, the 49 Marwa facilities have recorded 109,828 new outpatient visits, and the number is growing daily. In quest to commercialize the agricultural sector, the Department of Agriculture focused on developing and implementing projects that support smallholder farmers, youths, women and the fisherfolk in the county to sustainably produce and market agricultural and fisheries produce.
And solar dryer, Manukil Nwagi County Government of Kisumu. Gini en project maber, odhi konyowa kaka jolupo makaloka beach management unit. Nitie rech mang'eny mawuok ei bijwa ka, to wasebedo gi tabu. Samoro rech leo, koro gini dhi konyowa, odhi konyowa, wanyalo keto rech ka kae tuo kapod wadwaro chiro.
Vile tumekuwa kwa testing, naonelea ni mzuri kwa sababu inatusaidia. Ukiweka samaki unapata kama iko mzuri, haiwezi kuwa inaharibika hapo ndani, na vile stima pia haipeleki sana kwa sababu ikifika it is automatic. Kuna wakati ikifika inajisimamisha yenyewe, alafu baada ya kusimamisha kama moto imeingia kidogo tena inaanza. Tulikuwa tunatumia sana ice, na ile cold ambayo tulikuwa nayo ilikuwa ni kidogo. Kuna ingine tulikuwa nayo lakini ilikuwa ni kidogo. Sasa samaki zingine zilikuwa zinawekwa kwa ice, kama ice hakuna. Sasa watu walikuwa wanahangaika huko na huko wakitafuta mahali pa kuweka.
Capacity building for Fisher Folk community has been undertaking, training on bookkeeping, stock management, as well as connection to potential financiers done through the SLDP program.
We benefited from the agricultural program ASDP, and some of us were taken for training and some activities in Kisumu. We have been running along and producing fingerlings successfully. So local farmers have been buying tilapia fingerlings and also catfish fingerlings.
Efforts have been upscaled even in the setting up of a dairy excellence center in Muhoroni. The brick and mortar is ready. Offices, a production house. A new technology in the management of roads in Kisumu was adopted with the aim of increasing efficiency. The clay crate innovation sustains roads conditions up to 10 years. In partnership with Clay Crate Kenya, the department did a kilometer Guba Gita Namba Kabogo Filter Road. Major achievements have also been realized through construction and maintenance of county access roads for construction of box culverts, patches of new plants and provision of mechanical services. The Department of Roads pioneered the machine-based maintenance program approach, informed by the need to reduce costs of roads construction and ensure efficiency and effectiveness in maintenance. Under the program, 160 kilometers of roads were maintained across the county. In total, 270 kilometers of roads were opened and maintained. The department acquired a grader, 4 tippers, lorries, motorcycles, and a double cabin to boost the machine-based road maintenance project's supervision. To curb time wasted in fueling at petrol stations, fuel tank was erected and dispensing unit established to ensure efficiency in fuel distribution to vehicles and machineries. More schools across several sub-counties have benefited from installed tanks that offer relief to both parents and teachers. As a measure to curtail the spread of coronavirus, our learning institutions and health facilities, the department procured and distributed 22 number of 10 meters cubic water storage tanks in 22 primary schools. Learning is therefore uninterrupted. Waterborne diseases reduced amongst the pupils. Those efforts are in line in achieving safe water for the residents of Kisumu.
We are currently enjoying the benefits. It has really assisted in the improving of the hygienic standards of the school. And I want to say that it has also improved increment in the enrollment of the school.
The department successfully implemented a total of 72 water projects across all 7 sub-counties, bringing the coverage of safe water in the county now at 72%. Pupils no longer shy away from school. The pre-primary program focused on providing access to free, quality and safe ECD education to primary school children in Kisumu County. The ECDE infrastructural development was realized. ECDE sanitation, hygiene, school feeding program, ECDE capitation, under which writing and reading materials were distributed. Employment of ECD teachers was also realized.
First bunch, we had 44 chairs, plastic ones, tables we had 11. Then in the second bunch, we had chairs, steel chairs 80, and the tables we have 40.
Kambanda ECD is complete now. Onjiko ECD is complete. Okanja ECD is complete.
Classrooms and toilets were constructed for the children to have a good learning environment. The classrooms are of standard sizes, complete with teachers' room. In this year, 50 new classes and 5 toilets were constructed to completion. There are other 72 that are still undergoing construction. Breastfeeding moms working with Kisumu County will now be able to concentrate at work thanks to the setting up of the Dots and Rocks, a model ECD center and breastfeeding room. This is a brainchild of Mama Kisumu, Dorothy Nyong'o. Alongside the Dots and Rocks, a nutrition action plan was launched.
The nutrition aspect is really crucial. As you've heard from the previous speakers, the nurturing care goes hand in hand with nutrition.
We have been consistent in the disbursement of the bursaries and scholarships to needy students across the 7 sub-counties. Last month, we assembled here to distribute 45 million to help give hope to our students. This brings to shillings 250 million the total amount of bursaries distributed in this particular financial year.
Agoero kamano ahinya gima jatelo timo agonero kamano Nyasaye mari gwedhe o chieng' mane chamowa cha ok chamwa koth mane gowa ka koth biro to waringo malich magigi pukore maji kwanya sani ok pukre.
Auso stol kaka beti e kom kaka ng'amo ng'ol nomiya chi stol nono moka juogi aseneno ber ka giga odong' tasoyo ka asoyo sito.
The skirt swung left, right, and round, and to the beat they all moved in step in preparation to host the Pan-African Cities Conference. A lot of work has been put in place, sensitization of those in the hospitality industry ready to host the 10,000 delegates.
The world then will have an opportunity to view Kenya through the eyes of Kisumu.
Many residents have also registered for B and B. Kisumu has a new face forming, even as Afri-Cities is some shy 6 months away. After its groundbreaking, the conference center is progressing day by day. Kisumu, the journey, has brought out the best in the people of Kisumu, galvanizing us as a family, and together we can pride ourselves in its success and achievements. The journey continues.
I have seen the future and it works.